I'm making this short video to help you fill out the milestone-based evaluation form and to help understand the context of the form in the next accreditation system designed by the American Board of Medical Subspecialties and the ACGME. So what is a milestone exactly? They're the key to the next accreditation system of the ACGME. Milestones will need to be assigned by the program directors and clinical competence committee, and that data will be submitted to the ACGME every 6 months. A milestone is a knowledge, skill, attitude, or other attribute, and they're organized from less to more advanced and are descriptors and targets for resident performance from the start of residency through to graduation. The milestones are organized according to the core competencies, and those competencies have been further broken up into sub-competencies. So, for example, under patient care and technical skills, that's been broken up into PCTS1, consultant, and PCTS2, competence in procedures. And the other ones have been broken up similarly. So what does a milestone look like? This is an example of one of the milestones. This is PCTS1, consultant. The milestones are from level 1 to level 5. Level 1 would be expected of someone who is a first-year radiology resident. They can use the ACR appropriateness criteria, they can use the electronic health record, but haven't achieved a milestone level much higher than that. Level 2, they recommend appropriate imaging of common conditions independently. Level 3, uncommon conditions independently. And level 4, they're integrating a few different factors into the consideration to recommend imaging. And at level 5, they're participating in research, development, and implementation of imaging guidelines. So the levels roughly correspond to the year radiology resident that they are. For example, a level 3 is what you may expect a third-year radiology resident to have achieved. A level 4 is set as a target for graduation, although at this point it is not a graduation requirement. And level 5 milestones are designed as aspirational goals, something you might expect from a radiologist who has been out in practice for a few years. So when you're assigning the milestones on your evaluation form, you're going to keep in mind the level of training that the person is at. And if you select a response box in the middle of a level, that implies that the milestones in that level and in lower levels have been substantially demonstrated. So a level 2 means that they can recommend appropriate imaging of common conditions independently. Well, what if they can recommend imaging of common conditions independently, but they can also recommend some imaging of uncommon conditions independently, but they're not quite there? Well, in that case, you would choose the box in between 2 and 3, and that would mean that the resident has achieved level 1, level 2, and some of level 3. For competence in procedures, keep in mind that the language here describes basic procedures, intermediate, and advanced procedures. So for those of you who have procedure-based rotations, or at least procedures built into your rotations, I'll be in touch with you to put those definitions in your goals and objectives so that residents know what is considered beginning, intermediate, and advanced. And for level 4, in order to achieve level 4, the program directors will have to certify that they are able to independently and competently perform all of those procedures. And if any of these pertain to your rotation, we should talk about numbers required and the procedure for certification. Level 5 participates in research, development, and implementation of imaging guidelines. Again, this is aspirational. Interpersonal and communication skills. 1 is with patients, families, and caregivers. The language here states that as you progress, you are able to communicate under more and more challenging conditions with less and less supervision. For effective communication with members of the healthcare team, which is ICS 2, your written and electronic communication continues to improve on and get better and better even as the cases become more and more complex. And the verbal communication also progresses to where you're able to communicate under more stressful situations and then eventually in all circumstances. Under medical knowledge, for protocol selection and optimization of images, we're going to have to define what is basic, intermediate, and advanced imaging, and then use those definitions to help the residents know what to aspire to. For MK2, interpretation of examinations, their observations get better and better. They're able to make more and more subtle observations. Their differential becomes tighter, and they're able to eventually integrate current research and literature to recommend management of patients. For professionalism, all of the attributes in level 1 need to be adhered to in all the levels, and the thing that changes between the levels is that they become an effective healthcare team member in level 2, a team leader in level 3, and a role model in level 4. For practice-based learning and improvement, there is one level on contrast agents, radiation safety, and MR safety, which is outlined here. So those are the milestones that you'll be assigning. Please let me know if you have any questions. Thank you.